you for coming out to my talk. Like she said, my name is Dr. Laurence, and I'm going to be standing up here for what feels like an absolute eternity for me, but I hope it doesn't feel that way for you. My topic today is prayer as a treatment tool in the treatment of chronic illness, and really the heart of this talk came about because I deal with patients who are suffering, and I sit across from them every day and listen to their stories. And a lot of the times, obviously I have all these fancy tools to kind of help them heal, but a lot of the times I sit across from them and I look at them and I just think to myself, like, wow, these people really need Jesus. They really need Jesus. And I think for a lot of people, the obstacle to cure can be spiritual wounds and a lack of, or like a resistance towards spirituality in general. And as we know all here, that we all are made for God and we all need Him. And so we live in a culture that is becoming increasingly obsessed with health. And so and also spirituality is kind of coming back into mainstream, popular culture. And so this is a great way to kind of help my patients be open to, the spiritual side of things. With my profession, it's a little bit difficult sometimes to bridge that topic with patients. If somebody's coming in and they're telling me all about the chronic migraines they've had for years, like, I can't just be like, cool story, bro, but like, have you heard about Jesus Christ? It's very awkward. And so being able to tie prayer into health has really helped me bridge that gap with patients. So, yeah. So, a little bit about me. I am a Catholic convert. I converted about 5 years ago. And I like to say I was dragged kicking and screaming into the faith. I did not want to be Catholic, but thanks to the rosary and some good friends of mine who really pushed me to think about things and kind of argued me into the faith, I was convinced of the truth of the Catholic Church, and it's been such a blessing ever since. I grew up in the Seattle area, just 20 minutes north of here in Mill Creek, and then I decided to go to Whitworth University for my undergrad, and then came back here to study medicine. I am currently the head of the Sioux House, which, if you don't know, is a intentional community for single Catholic women. And there's a picture of us in the upper right-hand corner there at my birthday party a few years ago, and that's just been such a blessing to have that community. And then, fun fact is I really like Italy, and so there's a picture of me and my friends who live in Rome, and he's actually an Italian actor, and the last thing he did was a commercial with Janet Sinner, the tennis player. So I'd say I'm famous adjacent, but yeah, they're really sweet. All right, so when I say that I'm a naturopathic doctor, there's probably a handful of people in here who are thinking, a natural what? And then there's another group of you that are thinking, okay, something to do with natural things or homeopathy. And then the rest of you suddenly have a very deep desire to tell me all of your most personal health issues. So please don't do that. Aunt Karen should probably go see a doctor, and no, you don't have cancer, all right? We got it all covered at this point. But no, so naturopathic medicine is a field where we are trained like primary care physicians. We go to med school for the same amount of time that MDs do. But we get training in additional therapies like herbs, diet, lifestyle, homeopathy, phys medicine, hydrotherapy, in addition to being able to diagnose and prescribe pharmaceuticals. And so it kind of gives me a lot more tools in my toolkit. And we focus on prevention as the best medicine and really try to tailor our treatment plans to whatever the patient is coming in with and whatever their goals are. And I'd say that the biggest thing that makes us different, honestly, is our philosophy. And so we view health as, or view ourselves as facilitators of the body being able to heal itself. And so really, as doctors, my job isn't to cure you or to suppress your body's natural mechanisms, but really just to support your body in healing its own self. And then the other thing is that we have this thing called the therapeutic order, which is on the left here. And that really helps us to determine when I'm taking a case, where do I need to start with a patient? And oftentimes it's multiple different levels at the same time. But I'm always going to be addressing the bottom level there, which is the determinants of health. And really those things are the fundamental things that bring about our health outcomes. And they are really important. And of course, that's things like sleep, exercise, community, the food that we eat, etc. And I personally really think that prayer falls into that category. I think it is fundamental for our health and well-being. And so as I go throughout my practice, I want to be able to bring that more and more into my visits with my patients. So the other interesting thing about naturopathic medicine is that because we're trained as primary care physicians, we don't necessarily specialize just like a normal MD does. However, we kind of focus our practice on a particular area. And so my practice is focused on chronic illness and especially complex chronic illness cases. I get all the weird stuff, the people that have been told that they're going to have things for the rest of their life, there's nothing that can be done for them. So kind of just like some background about what that entails. Chronic illness as a definition is usually defined as a condition that has been around for at least 3 months or longer. It's persistent with the symptoms. It often has the characteristics of not being fully curable, and that there's some sort of regular flare and remission cycles that kind of go on. And so my job as a naturopathic physician not only is to help patients have the tools to manage those flare cycles, but see if we can't find any additional root causes to their symptoms to have reverse disease. And so those are a handful of things that I treat in my practice. I see a lot of chronic fatigue. I love dealing with autoimmune disease, especially since I think a lot of patients don't get good care in the conventional medical realm with autoimmune issues. I do a lot of chronic infection stuff like chronic Lyme, chronic mono, and then I deal with autonomic dysfunction, POTS, and allergies.
POTS?
Yes. Did someone ask a question?
POTS.
To clarify the acronym POTS.
POTS stands for postural orthostatic tachycardia syndrome. Essentially, it's an autonomic dysfunction where you go from sitting to standing, and your heart rate shoots up, and you get really dizzy. So there are a variety of different causes for chronic illness. The most common that we kind of all think about, right, is our lifestyle. So making sure we're eating food that is healthy for us, getting enough sleep, exercising regularly, not overindulging in alcohol and drugs. Pretty self-explanatory there, but there are other things that people maybe don't think about as often. And that includes environmental exposures, right? So the contaminants in our air, in our water supply, mold exposure, I see that a lot, especially around here. And the chemicals and the things that we put on our body and expose ourselves to every day. I also see that the gut microbiome plays a big role, and gut microbiome disturbances. And so that's kind of influenced by what we eat, what kind of medications we use, as well as what the health of our parents' microbiome look like as well, so we can inherit that from our parents. And then lastly, this is a topic that is becoming more and more well known, but stress and trauma do play a big role in health, especially with chronic conditions. And so out of all of these, even though I believe prayer can help, whether directly or indirectly, with every cause on this list, I think it does have the biggest impact in the stress and trauma world. And so we'll kind of look at how it's going to do that. So to kind of break it down a little bit more, so there are variety of different mechanisms involved in chronic illness. Chronic illness is a quite complex issue. There's multiple different systems that are usually dysregulated, so it's not usually just one thing. I have a lot of patients that they're looking for the magic pill, or they want that diagnosis that's going to solve them, right? But it's usually a complex issue with multiple different factors going on. I see a lot of autonomic nervous system dysfunction, and that kind of plays into long-term immune system dysfunction. And then there's also that piece of endocrine and hormonal imbalances. And so to kind of explain that a little bit better, the diagram on the most left here is kind of breaking down the nervous system. And so our nervous system has kind of two main parts: our central nervous system, which is our brain and spinal cord, and then we have our peripheral nervous system, which is our cranial nerves and the spinal nerves that go out into the body to the skeletal muscles and the organs. The peripheral nervous system then is broken down into two sections. We have our somatic or voluntary nervous system, so I want to move my arm, therefore my brain tells my arm to move. And we have our autonomic nervous system, which is our involuntary side of the nervous system that regulates our heart rate, our breathing, our digestion, etc. And then further breaking down, the autonomic nervous system has two main branches, really three, but two main ones that people focus on, which is our sympathetic fight or flight response and our parasympathetic rest and digest. And so, when we are exposed to an acute stressor, whether that's a bear attack, a thief in the night, or even just an acute illness, our body goes into stress mode. And what that looks like is we've got our cortisol goes up, and so you can see on the diagram on the far right there, the brain is telling the adrenal glands to produce cortisol. And your adrenal glands are a little hormone organ that live on the top of your kidneys. And so that cortisol helps to stabilize our blood sugar, make sure our muscles get enough energy. And then we also see that our epinephrine, our neurotransmitters, go up as well to make sure that we have a quick heart rate and better circulation. And then blood flow shunts to our skeletal muscles so that we can run away and or fight. So after we are removed from an acute stressor, then the nervous system switches out of the fight or flight and back into the parasympathetic side of the rest and digest. And so the blood flow goes back to the organs, the neurotransmitters and the hormones get detoxed out, and breathing begins to slow and heart rate returns to normal. So that is what's supposed to typically happen. However, what we're seeing more and more of is essentially autonomic nervous system dysfunction, where we get stuck in the sympathetic overdrive. And there's a lot of reasons for this. One thing that I think is going on, obviously, is that we are experiencing a lot of stress nowadays, a lot of things that are terrifying to us. We have a lot of history of trauma. And the nervous system doesn't necessarily do a good job of differentiating between, let's say, a conflict at work and a bear attack, right? And so it's going to respond that same way. The problem is that when you've got these chronic stressors that go on for a long time, they don't necessarily go away, right? And so we can't get back into that parasympathetic state as easily. And so the nervous system just learns over time to essentially be hyper-vigilant to things because we never get back into that parasympathetic state. It loses some of that neuroplasticity to switch back and forth between the two, and then it becomes always on high alert. And one of my supervisors that I worked with would always say that chronic illness is a bad habit of the brain, which essentially is kind of what I was talking about. It pushes certain biochemical pathways over and over and over, which then downregulates the other side of the nervous system. So we can kind of get stuck in that way of being, and then that causes kind of downstream effects. Our immune system becomes also hypervigilant, reacting to things that it shouldn't be, constantly spewing out inflammatory cytokines. And then we also get from that hormonal imbalances. Because our adrenal glands are responsible for other hormones, not just cortisol, If we're shunting all the resources to making cortisol, we're not going to be able to make other things like sex hormones, for example. And so we kind of get all of this dysregulation, and what ends up happening is that we get stuck in a state of chronic inflammation. And as you can see in the middle diagram there, chronic inflammation causes all these things. And it's kind of the basis for a lot of diseases that we see, including cancer, metabolic disease, autoimmune disease, etc. So, what should we do about this? There's a lot of different tools that I have, and as is the scope of this talk, I want to kind of focus on prayer, particularly as a tool that I think can help us get back some of that neuroplasticity and to kind of help us go back into that parasympathetic state when we should be, and not be so over or dysregulated. So, what is prayer? Well, it is a lot of different things. Some beautiful quotes from the saints up here. I want to draw your attention to the top one there from Mother Teresa, and she says, "Prayer is as necessary as the air is, as the blood in our bodies, as anything to keep us alive." And that really resonated with me because like I was saying before, I believe that prayer is fundamental for our health and well-being, just as much as the oxygen is for our bodies, right? And so, just like we can't live very long without oxygen, we also can't really live very long without prayer, and we're created for that. And St. Padre Pio says something along those lines too. Prayer is the oxygen of the soul. Prayer is the best weapon we have, the key that opens the heart of God. And so, kind of, what are the saints telling us here? Well, they're saying prayer is good for the soul, which I think most of us know. They're also saying prayer is good for our mental health, and more of us are catching on to this. But they're also saying that prayer is good for our physical health, which I think we don't discuss very often. And so, yeah, that's why it's kind of on my heart to bring that about. And the reason that this is because we aren't just souls that are trapped in bodies walking around, right? We are holistic beings. We are soul bodies, body persons. And so the Lord has commanded us to pray. And we know that God never does anything arbitrary, but everything that he asks us to do always has a purpose, always has a reason, and is always what's best for us. And so prayer impacts the entirety of who we are, and not just one piece. So, just so you don't think I'm just up here spewing folklore, I wanted to give us a little bit of evidence for prayer and its effects on health. And just to give a caveat, there's a lot of words on these slides. Don't feel like you need to read them. I kind of highlighted the most important pieces. But a lot of the studies that are dealing with prayer and religious-based interventions are very broad. It doesn't focus on just one particular devotion or even one denomination. And so that does warrant more a need for further research, of course, but it can give us a little bit of a glimpse into what we're seeing as far as benefits that prayer can provide us. And one area that seems to be focused on in the research tends to be prayer's effect on depression. And the first study up here was a systematic review, which essentially means they took a bunch of studies, compiled them together, and watered down their conclusions and made a statement based on that. And what they found after they did that was that religious-based interventions consistently reduced depressive symptoms across diverse populations, including patients with chronic illness. And even more interesting was at the bottom there, they argue that the religious-based interventions actually had superior effects compared to the standard therapies for depression, which is a pretty big claim. And again, the religious-based interventions were pretty broad, so it's a little bit hard to standardize them, but that included things like personal prayer, passive prayer, pastoral counseling, religious-based CBT, and then also religious service observance. The second study down below was a 2-year prospective study. So they followed, basically what that means is they followed almost 8,000 adults for 2 years and had them kind of polled them on their prayer practices and how, what they kind of did with their religious practices, and then tracked their health outcomes. And they found that private prayer was significantly associated with recovery from depression. And they also found that religious service attendance had a protective effect on those who didn't have depression on developing depression later on. So that was really interesting. Another area that prayer is being researched in is in helping with pain. I have a lot of patients with chronic pain issues. The first study up there was a pretty small study of just 40 participants. They broke them down into half and half, 20 people that would consider themselves religious and 20 non-religious participants. They then had them do a prayer exercise, which I believe was, they gave them a prayer to essentially pray out loud. And then they subjected all of them to a painful electrical stimulation and had them rate their pain intensity and pain unpleasantness before and after doing the prayer. And they found that doing the prayer reduced pain intensity and pain unpleasantness, but only in the religious participants and not the non-religious participants, which was really interesting. So that kind of tells us that we can't just use prayer like we're taking a pill to cure things, right? We do need to have participation in our faith. We need to have that intention, believe that what we are praying and participating in actually does do something, because it won't really have the same effect if you're just kind of saying words on paper. And then that second study down there was another systematic review, and these people were looking at post-op outcomes. So essentially, their participants were undergoing some sort of surgery, including like appendicitis was one of the types of procedures. And they had them all broken down into groups, religious, non-religious, and they gave them a specific task to do. There was a group of active prayer participants, so they were praying something out loud, and there was a group of passive prayers, so they were listening, and then a third group that was doing some sort of meditative exercise, whether that be journaling or walking in nature. And they found, and then they had the participants undergo the procedure, and they tracked their outcomes afterwards. And they found that active prayer to God was actually the most beneficial form of prayer, and particularly helpful for religious patients. They also found that the passive prayer did help as well, but not as much. And they weren't sure kind of what the mechanism was for that, but they did see that people recovered faster and had less side effects following surgery. So. And then the last big area that we're seeing research being done is in lifestyle. And the first study up there is another longitudinal prospective study. So they looked at almost 24,000 European adults over 11 years. And they tracked their prayer participation and their behaviors essentially. And they found that praying and religious organizational participation was associated with lower odds of engaging in negative health behaviors, such as smoking, sedentary, negative physical activity, alcohol consumption, and weight gain, and I think also sleep problems. And interesting enough, they also said that the more religious group, the one that was praying, going to a religious service, and also had some sort of religious education and did all three, had the lowest odds of participating in these behaviors, even more than just the group that was only praying or only just had some background of religious education. And then the last study here was another systematic review, and this one was pretty broad. They were looking at studies that were from over 2 decades, and their criteria for spiritual intervention was pretty broad, but they compiled all the research they found, and basically they saw that the participating in these religious-based interventions resulted in lower all-cause mortality in these patients, better quality of life and life satisfaction. And then, really interestingly enough, they noticed a dose-response relationship, which essentially means that the more these patients engaged with these spiritual interventions, the more benefit they received. And they also went and polled people on, how important spirituality was to them. And they found that spirituality was important to the majority of patients, and the patients who wanted more spiritual care and healthcare settings. And so they advocated for more education for healthcare practitioners around spiritual care, more access to spiritual practitioners like chaplains. And then they also determined that spirituality was a social factor of health, like I was saying, it being like a fundamental necessity for health. So we've seen some evidence, but why is this happening? So one of the things that I think is going on is I think that prayer helps to increase that parasympathetic activity that we were talking about in the beginning, specifically through the vagus nerve. And the vagus nerve, if you don't know what it is one of our cranial nerves that comes out from the brain. And it is the major cranial nerve that is part of our parasympathetic nervous system. It innervates many different organ systems. And when we get stuck in that sympathetic state, we lose the blood flow to these organs. And that results in poor organ function, poor nutrient absorption, poor digestion, etc. And over time, that results in chronic illness. And so prayer can help with stimulating that parasympathetic activity through the vagus nerve. You can see there in the diagram that there's a few nerve branches that actually go to the larynx from the vagus nerve. So especially when we're praying out loud or doing some sort of chanting or singing, we help stimulate that vagus nerve. Another mechanism I think that is going on is that prayer helps us to offer up our suffering, and it gives us meaning. It can reframe our perspective. A lot of times, we as Catholics, we tend to love to do penance, and we know that sometimes, as miserable as suffering can be for us, it often can lead to many benefits. And so having prayer as a tool to help us move through difficult things and give us a new perspective is really empowering and can help patients make it through whatever they're going through. And then the third thing, as we saw in the studies, prayer can affect our lifestyle habits, and that's of course through multiple ways. And one way I think is because of when we're participating in our faith organizations, we tend to build community, and that community helps keep us accountable. If we are surrounded by a bunch of people that are trying to grow in virtue and get rid of negative habits, we are going to be more likely to also follow along with that. And then kind of that second piece is, as many of us in here know, sitting with the Lord in prayer, He brings things up to us and convicts us of things that we shouldn't be doing. And like I was saying in the beginning, right, like anything that God tells us to do or to not do isn't arbitrary. There's always a reason, and it's because it's for our good. And so when He's convicting us of these things and pushing us more towards the good, we tend to also then live healthier lifestyles. The next thing on here is that prayer, again, kind of helps us be in community. And I think that our culture has really lost the art of living in community. And it's so important that we gather together and really help each other. There's I don't know if you guys listen to the Lila Rose podcast ever, but Adam Lane Smith is a specialist in attachment theory, and he was saying because there's been so much disruption and degradation of the family, we're now seeing the majority of people having insecure attachment styles. And what transpires from that basically is that those people have a more difficult time forming bonds with others because of past trauma, which leads to lower oxytocin levels. And so essentially what we're seeing in our culture is grasping at trying to fill that void of that love, but also those lower neurotransmitters. And dopamine tends to be the chemical that people turn to. But the problem with that is that it's not. The psychological effects of dopamine are short-lived, and we can burn our dopamine receptors out quickly. And so if we're always just going for the dopamine, it doesn't really fulfill us in the end. And so it's important that we come together and build that community so that we can heal each other's wounds and form those bonds and secure attachment together. And then the next piece is processing trauma. So I think kind of along the lines of what I was saying before, when we sit in prayer, most of us have had some sort of revelation in prayer that the Lord has been like, I think we need to work on this, or I see this wound, or He brings things up to us and gives us a new perspective and stuff. And while I don't discount the importance of counseling and things like EMDR, having a Lord who knows your heart fully and is able to communicate with you in the way that you need Him to is an invaluable tool. And so just sitting with Him, sitting in adoration, can be life-changing for people. I know for myself and any of the girls who live in my house with me, we always say that one of our charisms is healing. And if you talk to any of the girls, they would say that before they moved to the house, they thought there couldn't possibly be more that the Lord wants to do, right? But He's always pushing us further, and He really wants us to be whole and to flourish and to heal us. So the last piece there is that prayer helps to increase vitality, and vitality is a buzzword in the naturopathic community. It's a little bit hard to define and to measure, but essentially vitality is your desire for life. It is your purpose, your meaning, but also your capacity to handle the things that are coming at you and to adapt and to recover from stressors of life. And so with a lot of my patients, I'm seeing that they have really low vitality, that when something comes along, whether it be a stressful thing at work, or they take a medication or a supplement that they don't respond well to, they are sick for a long time after, and they don't recover very well. And so I think prayer is a useful tool to kind of help increase that vitality. Okay. So we've learned all these really cool things, but what are we going to do? I think that when we better understand our biology, we can orient our prayer practices to help us live healthier lives. And then in turn, if we have our prayer life in going hand in hand with our biology, our prayer life is also going to be more fruitful. And so I have some suggestions of things that would be helpful. The first one on this list is to pick a routine and to stick with it. The body is very adaptive. It loves routine and predictability. So if you have your prayer time scheduled in, the body knows it's coming, and it knows, okay, now I can rest, now I can relax. And kind of the second piece to that is sandwiching your day in the morning and in the evening. Prayer in the morning is really important for setting the tone for your day. Not first thing in the morning, grab your phone, look at all the things you have to do, and start being, worrying about all the things on your list. But to really get up and spend that first bit of the day with the Lord, offer it to Him, offer Him whatever is going to come up in that day, and leave it into His control is really important. And then you can go into your day with that grace and peace. And not only that, but if you have that prayer routine, especially in the morning, you're going to be more likely to not hit your snooze alarm 5 times and really stick to that sleep routine, which studies are now showing is almost as important as getting enough sleep, is to have a consistent sleep routine where you go to bed and wake up at the same time. And then kind of along those same lines, praying before bed helps you to essentially come down from the day, re-regulate your nervous system. You can turn the lamp on, light a candle to decrease your light pollution, so that will help your melatonin increase and help you sleep better. But you also can kind of reflect on your day with that examination of conscience, for example, and just think about all the ways that the Lord has really brought you gifts and blessings throughout the day, things you're thankful for, people you're thankful for, and then also things that you want to work on, and kind of helps push you more towards virtue in the next day that you have coming. The next piece is silent prayer and or a silent retreat. We need more silence in our day-to-day life. We are so bombarded by media and phones and texting and constant just over information all the time that our nervous system is always just like, okay, what do I do with all this? And if we've got that heightened sympathetic state, it's going to view a lot of things as threats that aren't. And so taking time to be in silence is really important to help regulate your nervous system and to increase that parasympathetic tone. Kind of along those same lines as if you have a stressful situation coming up throughout the day, taking time to allow your nervous system to flip back into that parasympathetic state instead of just pushing through it. I know as a society we go through really traumatic or stressful things, and then we're just like, okay, head down, I'm just going to keep going. But that's not really how we're designed to work. And when we do that, we get stuck in those states of overdrive. And so just taking a moment, doing some deep breathing, using the Jesus prayer or Hail Mary to do some sort of circular breathing. Some people will breathe in, they'll say, Jesus, Son of the living God, and then breathe out, have mercy on me, a sinner, for example. And that'll just give you a second to reset and to give whatever happened up to the Lord. The next piece is, a lot of my patients struggle with insomnia and difficulty sleeping. A lot of people because they have too much cortisol floating around and not enough melatonin. A lot of us have been there where it's, we're heading to bed, and we're like, oh no, I spray my rosary, right? And then you get into bed and you make it like 1 decade before we're out. So, if you're having trouble sleeping, pray the rosary. It's a great way to do that. And I think a piece of that is because of the repetitive nature of the rosary. And then that next piece is singing prayer. Like I was saying in the slide before, the vagus nerve has branches to the larynx, and when we sing or chant or hum, it helps stimulate that parasympathetic activity, which is just so cool. I feel like Mother Church is so intelligent in that way that she gave us these many different ways to participate in prayer. And then the last is prayer and community, whether that be praying your rosary with a bunch of friends, or going to Mass together, or praying the liturgy of the hours together. Building that community is going to be really important for all of us, and I think especially in today's day and age when we're so isolated from each other, it's really important to have that. Okay. So in conclusion, I believe that prayer is something that is commanded by Christ for our well-being. Our faith is not just a hobby or a personal preference, but that it is vitally important for our overall health and well-being, and that without it, we begin to suffer spiritually, mentally, and also physically. And from that, I believe that prayer should be an essential part of a well-rounded treatment plan for any illness, but especially for patients with chronic disease, because I see so much of that autonomic dysfunction causing all these downstream problems. And so in conclusion, I will leave you with this. A man named Juan Perez Mora held the Guinness World Record for being the oldest man alive from February 2022 until his death in April 2024 at the age of nearly 115 years. When asked for the secret to his longevity, he stated that he worked hard, he rested well on holidays, and he prayed the rosary twice a day. Thank you.